in all the diabetes, be it type 1 or type 2, they have to be predominantly understand that they will be prone for some complications which are of microvascular and some which are macrovascular. Microvascular means complications of small blood vessels, which includes retinopathy, means the damage to the retina of the eye, which causes blurred vision, dark spots, and ultimately sometimes which can cause bleed and detachment of retina, that the patient can become blind. Neuropathy. Neuropathy means the nerves of our feet get damaged. So there can be a feeling of pins and prick sensation, walking on the pebbles, or sometimes we can have no perception, which can be very dangerous because they lead to ulcer formations, and when the ulcer formation, they can lead to secondary infections. Third is nephropathy. Nephropathy means damage to the kidney. So when it causes damage to the kidney, they causes loss of proteins in the urine, and ultimately they lead to the derangement of the kidney function, and the patient becomes dialysis dependent. Macrovascular complication predominantly means that he can have effect of the heart attack in the normal, or myocardial infarction, where the blood vessels of the heart are choked with excess fat and they can cause myocardial infarction. Peripheral arterial disease means the limbs, the blood circulation to our limbs can get stuck and they can change to loss of blood supply, which causes dry gangrene and then infective and amputation of the feet. And cerebral vascular accident means CVA, stroke, means hemiparesis or paralysis can occur because of this macrovascular complication. Along with it, there are other comorbid conditions, means these conditions are most frequently seen in diabetes. The thing is hypertension, lipid metabolism abnormality, where they have high lipids, fatty liver. These are some of the comorbidities which are seen. Another important point that we forget to discuss with the patient is that yes, we have to learn to live our diabetes, and we have to learn how to cope with our diabetes, because many of the cases where poor insulin, where poor glycemic control, the patients become depressed, and because of depression the sugar control becomes very tough, and it is very important that psychologically the patient is made at peace to accept the disease. He forms a team with his doctor, and they, as a team, they work towards the better management of diabetes, which is possible in every possible case, and we don't go into depression, which can further decrease our which can worsen the glycemic control to the further extent. So with this thing, friends, I take leave. Thank you for my patience here.